If your friend mentions suicide or self-harm, take them seriously. If you believe that they're in danger, call 911 or the Poison Control Center immediately. Your friend's life is more important than their privacy. Wellcasters. Have you ever had someone just want to end it all? Permanently? It's never easy to think about or hear. Yes, life can get so complicated and overwhelming, it's hard to even imagine that things would ever get better again. But most people bounce back. Unfortunately, some don't. Suicide is a tragedy that affects everyone, and it's one of the leading causes of death for people 24 and younger. Here's what to do if you suspect a friend might be having thoughts of suicide. Tip 1. Learn to recognize dangerous signs. Has your friend talked about feeling hopeless or anxious? Have you noticed a change in your friend's behavior, acting withdrawn, sleeping less, sleeping a lot more? Maybe they're abusing alcohol or drugs, giving away their belongings. Maybe your friend has even talked about hurting themselves, or worse, wanting to die. For a complete checklist of suspect behaviors, pause and print out our worksheet. Tip 2. Initiate dialogue in a non-judgmental way. Sit your friend down in a comfortable or familiar environment where the two of you can talk privately and freely. Start by telling your friend how much you care about them, but some of their behaviors have concerned you. Refer to our worksheet for ideas on how this conversation might flow. If you determine that your friend is in danger and that they need help immediately, please call 911. Household items like pills or razor blades, they quickly become lethal weapons in the hands of a suicidal person. Tip 3. React with feeling. If your friend does confide in you thoughts of suicide, be compassionate and make it known that you're there to listen. Don't aim to change their mind, start an argument, or give advice. Many people who attempt suicide don't actually want to die. They just want their suffering to end, and suicide seems like the only avenue. Engage in conversation with your friend and find out what's hurting them. Tip 4. Shift the focus from sources of pain to resources for treatment. In addition to external challenges, your friend might also be fighting internal demons that require professional care. Depression, anxiety, and other mood disorders are often present in the suicidal. Many of these illnesses can be diagnosed and treated. Encourage your friend to seek help and offer to work with them to locate a mental health professional or clinic. We strongly recommend looping their family members into this process. Tip 5. Lastly, stay connected, even after your friend has sought help and seems to be on the path to healing. Encourage other friends, roommates, and family members to check in on your friend during this vulnerable time. This is an especially important step, since many suicides occur in a period of apparent improvement. Listen, this video is a starting point. Please do your own independent research to identify more resources. But here are a few we recommend.